Okay, well, thank you. With that, I'm going to start recording the meeting, and I'm going to turn the time over to both of you. And if you could just say next slide when you're ready for me to go forward with the presentation.
Great, thank you. So, Anna, did you want to start, or would you like me to kind of kick in here?
You can kick in. Let's go with the next slide.
All right, let's go ahead and go on to the next slide there, Valerie. So today we're going to talk to you a little bit about everything, about what a doula is, how they're trained, and how doulas work with the families, and how doulas work with the providers in the hospital setting as well. And so today, in this slide, John Kennel had a quote that we love to use, and he is the co-founder of DONA International, which is one of the largest, if not the largest, doula training organizations in the U.S. And his quote is, "If a doula were a drug, it would be unethical not to use it." And he saw the benefits of doula support for families, and how much they benefited from just having somebody in the room with them to guide them during the labor process.
Also, this is Paula. I just want to add that, somebody in the room to guide and comfort them, in particularly that doesn't have any other job besides that. And I think that's very important because, yes, other people can provide labor support to a laboring family, but other people, other professionals that may be involved have other skills and other responsibilities, and family members have an emotional attachment that it's different than having somebody in a professional role just with the focus on the laboring person. I also want to say that I love this image because it portrays the laboring person as the protagonist and the focus of the process, and the doula being, kind of on the smaller figure, very in tune with the mother-to-be, but not taking charge or not, taking control of the situation, but just really putting the person that is in labor as the main focus of it all. And I think that really sums it up what Dr. Cano, and the other founders of DONA had in mind for the position of the doula. And it's not to take control or power, but to give it to the family.
Next slide, Valerie. So as you see the definition of what is a doula, I'm sure many of you, I know there are some doulas here, but I'm sure those of you who don't know what a doula is, that's sometimes the biggest question. What are they, what do they represent? And so doulas are, as you see from the slide here, is a trained professional who provides continuous physical, emotional, and informational support to a mother before, during, and shortly after childbirth to help her achieve the healthiest, most satisfying experience possible. And that's in a nutshell, is that we are there to support the families. We're not there to tell them what to do. We're not there to tell the doctors and the nurses and the hospital staff what to do. We're there to help them understand what questions to ask their providers. And we offer that physical and emotional support that the other providers are not able to do because they have another job, they have other responsibilities. And so the doula can kind of help with a lot of different ways and help the families empower themselves to ask the questions that they need to feel informed about their process. Valerie, can you go ahead and move on to the next one? Thank you. And here's a picture, another picture of another doula working with a family sitting on the ball, nurses in the background still watching, and they're just working quietly together, moving through. Go ahead, next slide. Anna Paula, did you want to talk about this?
Sure, I'll jump in. So there are several professional organizations that train doulas in the United States currently. We'll start with DONA International, which is the organization that started the doula movement. The founders of DONA were the first ones that used the term and started to train doulas, not so much as a side gig or, you know, continuation of childbirth education, but as an independent job that is just really to provide support for families. Dona International is a nonprofit organization, started in 1992. We now have doulas certified through Dona in over 54 countries, so it is quite big and it's quite out there. There are about 8,000 active members, and throughout the years we have trained more than 12,000 doulas. ICEA, International Childbirth Education Association, is also another nonprofit organization that started in 1960, and ICEA also trains and certifies doulas as well. Next slide, please, Valerie. Then we have CAPA, which started in 1998, and they certify and train doulas, also childbirth educators and lactation educators. And CBI, which started in 1999. And then there are many others. There are, you know, Birthing from Within, To Labor, many other smaller, new organizations that train doulas. But I would say these are the ones that have been around for longer time and that follow very similar scope of practice and code of ethics. Next slide, please. Thank you. Now, one of the differences that a lot of times it's challenging for hospital people to understand is that not all doulas that come to a hospital have been trained. Sometimes, you know, they could be just a friend of the family, and they could be the yoga teacher, or they could be, you know, a doula enthusiastic, but not necessarily somebody who's gone through a professional training. Also, from the ones that have gone through professional training, not all of them decide to follow through the entire process and become certified. The certification process is not only the training with the organization is a significant part of the certifying process, but that process includes many other steps, including education in lactation, including in providing support for initial breastfeeding, including a very extended required reading list, and they have to provide labor support for some families and be evaluated not only by the families, but also by the medical professionals that work with them. So they do understand what is their professional role inside that room and what they do and don't do. And also, before we go, we can stay in this slide, but it's also important to know that there are some doulas that also have different jobs. So it's very common that doulas can also be a childbirth educator / doula, or a massage therapist / doula. But, you know, that's a common trait that comes with that. They can attach to that. But it's an important difference for hospitals to know that, you know, the main issues that we see with doulas in hospitals come from people that are not even necessarily doulas, not even trained. Okay, now we're ready. Thank you. So there is, you know, because doulas are not obliged to be regulated, we don't know exactly how many doulas there are. Doulas don't need to be certified, so it's hard to know from each organization. But there is an estimation that there are about 30,000 working doulas in the United States right now. And according to the Center for Disease Control and Prevention, as of 2014, there is a lot more births than doulas happening out there. So we have, you know, almost 4 million births and 30,000 doulas. So it is still new, you know, even though in large metropolitan areas, doulas are very common, it's not as common as, you know, we may think it is if we are in a metropolitan area or in California.
And so to add to that, as you can see, there are so many families and women that we can support as doulas. Even those who can't afford them, we can absolutely, there's enough women who want to support families, and there's enough of us out there that can do that, and we can do more, we can train more. So where do doulas work? They work in the home, they work in the hospital, and they work at birth centers that are actually attached to hospitals or attached to home birth midwives. Go ahead, next slide, Valerie. And they are all paid very differently, and each state, each city, I guess you would say, county or whatnot, there are all different ways that doulas set up their fees. Most of them, however, are independent and are paid by the client themselves. And how they do that is they are interviewed and they choose the doula that is the best fit for them. And then they sign a contract and pay the doula directly. And then some doulas are volunteers for organizations and or hospitals, and they don't get paid at all. And some volunteer doulas are usually trained. Most volunteer doulas are usually trained because that's what the organization and or hospital wants them to be. So they don't necessarily want them to be or need them to be certified, but they definitely want them to be trained. And the goal is usually to have them certify eventually. And some volunteer doulas are wanting to certify, and one of the ways to certify is to have some births under their belt, and so they volunteer to support low-income families or those underserved. And then some doulas work in the hospital doula programs that are actually created by the hospitals, and then they are paid by that hospital or institution. Next slide. So as you see, this just reiterates what I said, is that with volunteer programs, sometimes doulas just get no money whatsoever, or they get a small stipend. They may work on a rotating or on-call basis. There's typically not a prenatal contract with the client because they're volunteer, and they just get called when and if the mom is ready for them. And there's typically no fees for the families. But then in paid programs, hospital will collect a fee from the family, and then the hospital will pay the doula. And then different prices are for different levels of experiences for doulas. So if we've got a newer doula, she may not get as much payment as the doula with more experience. And then sometimes doula work in shifts or per birth. Optimal is per birth, because we want the family, the whole point of having doula support is to have continuous support throughout her labor, and to have another doula come in after an 8 or 12-hour shift is hard for that mama, because that's exactly what's happening with the nurses too, is that they're coming in and coming out, and the role of the doula is really to be there throughout, to be that continuous support throughout for mom. Next slide.
I just want to add that, considering, you can say on this new slide as well, is that most of the hospitals that incorporate their own doula program, either volunteer or paid, these doulas will also go through some additional training that is particular to each hospital. So they really do understand the culture of that hospital, the lay of the land. So they really become very familiar with the staff. They become very familiar with the doctors and midwives in that hospital. There are different styles. So, it really is a more specific way of working, which is very beneficial for both the hospital, the families, and the doulas, because they all become very familiar and friendly, and then consider part of the care team. And now this is the hospital-based nurse doula committee that happens right here in Los Angeles at Cedars-Sinai. This committee was born from another committee. This hospital has a committee that is called, oh my goodness, it's escaping my mind right now, but it's a committee that really identifies the needs for each laboring family and their particular desires, and it's a committee that involves many different chairs of the hospital. What ended up happening, I was invited to be part of that committee as a doula and childbirth educator of the city of Los Angeles, not so much of the hospital. But what happened is most of these meetings would be addressing doula nurses issues. So we decided to create a particular committee that would be formed in between labor and delivery nurses and birth doulas that would address issues that would happen inside the labor room, either lack of communication or clarification of the role of the doula or clarification of the role of the nurse. And this has been so successful that we are now on the third year, and this committee continues to grow. We have now incorporated both postpartum doulas and postpartum nurses, because a lot of times, the birth doulas will go to the postpartum area after the birth, and some issues can come up there. This committee also has an email that both doulas and nurses can email to either compliment a fellow doula or a nurse they work with, also to share frustration. So if a doula was working outside of their scope of practice, they can clarify and make sure, a lot of times nurses don't even know if that was inside of the scope of practice or not. So they'll just describe a situation of, the doula advocating for where the IV was going to be placed, in the forearm or the hand. And the nurse is like, well, is that their role? So a lot of that becomes then they are invited to come to our meetings. We can discuss, we can hear, and then we can discuss, where exactly the doula was or was not inside the scope of practice. Based on the emails and the conversations that we have, we also have made some efforts to educate both doulas and nurses in clarifying our roles. So we have done a teaching day for doulas, so doulas that wanted to become more familiar with the hospital. It was a full day. We came together, and nurses taught some subjects, doulas taught others, and it was really more than clarification of roles. A lot of, fellowship and just friendships being formed, and doulas really felt that they were starting to be accepted as part of the care team. This is Los Angeles. It's a very high volume hospital, and also, a hospital that works a lot with doulas. So doulas are just not going to go anywhere, and at the same time, we really needed to find a way to work together. And the results have been extremely positive. We have done, events that doulas cook meals for the nurses, and we bring them, food for every shift. And it just really has made doulas be more appreciated in the hospital, has also helped doulas to understand a little better all the challenges that nurses face in their day-to-day and their tasks and all of that. So we have helped to create a birth plan for the hospital, with doula's touches and adding terminology that are familiar for families and that are more friendly and that focus on non-pharmacological ways of coping with labor as well as medicine. We have come up with a document that we do not require doulas to sign, but that it is in their room, in each labor room, letting every family know that the hospital welcomes doulas, but that, they do understand also what is the scope of practice of a doula. That has been helpful for the fellows that walk into the hospital portraying to be doulas, but that are not necessarily professionally trained. So everybody understands what a doula does and doesn't do. And we'll discuss a little bit more down the road. But this has been a model that has been extremely successful and has brought great culture change in the floor and for the families and nurses and doulas. Next slide, yes. One great example of a doula program inside a hospital is not in California, it is in Washington, in Seattle, at Swedish Hospital. This program is about 1 year old, and their results, they just sent their report recently, and I was just fortunate enough to have been in touch with the doula that was hired to install this program. And so what the hospital did is they hired a local doula group called Ohana Doulas to consult and help them to put this program together. And I think there is a lot of value to partnering with doulas. So it's not just the hospital, doing something on their own. It's a collaboration in between the hospital and doulas. They have 41 independent contracted doulas. They speak 9 different languages, and their satisfaction rate is phenomenal, 4.9 out of 5. The doulas have attended about 340 births in this past year. Next slide, please. And the other great benefit is that the medical staff has also been, extremely satisfied with the doulas from this program. So 98% of the nurses and providers want to work with Swedish doulas again. 98% of doctors, nurses, and midwives say the doula had a positive impact on the patient's experience. And then you can read some of their testimonies there that they publish in their report. Next slide, please. They also provide continuing education for these doulas, and some of these topics include cultural sensitivity, supporting clients with a baby in the NICU, understanding and interpreting maternal health research, and in 2017 they have plans to begin offering free doula services to low-income families. And a doula diversity scholarship has been created to support the development and entry of doulas of color, LGBTQ communities, for doulas and doulas from other underrepresented and underserved groups. So as you can see, this really bridges so many gaps from the community and the hospital. Perhaps, if it wasn't for this program, all these topics would not even be discussed inside of the hospital. So, a lot of times doulas bring these sensitivity and sensibility topics that can be so helpful for the entire hospital to adapt and adjust to serve families in a more loving and wholesome way. Next slide, please.
Just really quickly, we're getting some questions off from everybody, and I'm not able to type for some reason, but I wanted to let you know that we are going to have a 15-minute question and answer section here. So if you'll bear with us, we will get to answering some of your guys' questions, so as many as we can, okay? Thank you. So the benefits of having a doula for mother and partner has been researched for a long time and for many, many years. And the benefits, it's shown, doula support has decreased so many interventions in the hospital and has helped increase the family's satisfaction with their birth, regardless of how it turns out. So whether it's an unexpected C-section, whether it is a planned vaginal, no medication birth, and it happened that way, or there were some bumps in the road, having doula support has increased that the parent and partner's satisfaction. Go ahead, next slide. That women's having continuous support during labor is more meaningful to them than having pain medication or physical support. And this comes from listening to Mothers 3, Jean DeClerc's research about what families are looking for during their birth, or what have they associated with their birth, what's happened to them. And the word doula was mentioned in 93% of births where the mother had a positive experience. Next slide, please. Now, as Anna Paula had mentioned, possible barriers for hospital staff to provide labor support. The biggest thing that I think that we've heard from so many nurses, at least I know I have over the years, is they come to me and say, Michelle, I wish I had time to sit with my mamas and work with them and guide them. And some do as they can. But what ends up happening is that they've got so much charting to do. Some hospitals have multiple patient loads for the nurses, or there's a hospital culture that does not view labor support as the role of the nurse. And the high epidural rates that, it's very interesting when I go into hospitals and how they're like, wow, this mama did this unmedicated. We have so many of them that come in and immediately want an epidural. And then limited experience providing labor support. So not really understanding comfort measures or how they can personally help a mother who does not have a doula. Next slide. And then possible barriers for doulas in the hospital setting is that they don't really, there's a lack of understanding, on the professional role of the doula. And then there's mixed information on the scope of a doula. What can a doula do? And then the cost, of course. The cost is very prohibitive for some families. And then some staff see doulas as an obstacle of care and may not necessarily be welcoming to them in the hospital. And then staff sometimes are not willing to get to know the doula. Next slide, thank you. But then how can doulas really help within the hospital setting? So we offer a lot of different things, and I think it's really important to get to know the doula that's in the room with you, so that way you can understand kind of how they can help you as well. Look at them as a team member, not just somebody who's just there for the family. But they can provide shared decision-making, confidence building, relationship-based care, helping to bridge that gap with the hospital staff and the parents, then offer non-judgmental support, become a mediator, just kind of talking things over for the families and for the nurse and the doctor who and the midwife who may not be able to talk well. Something happens and maybe they're kind of butting heads, but then the doula can come in and say, hold on a second, let's all take a breath and let's see what the real point is here. And then helping the families to understand what normal birth is.
So I'll talk a little bit about, you know, some of these items. I feel like, and we can go through the next slide, you know, but a lot of these, like, even when we talked about the barriers, you know, in metropolitan areas, we see that these barriers are becoming less and less, that, you know, people are really starting to understand the benefits of having one extra person there to care. But, you know, it is important also to clarify some of these things. So, for instance, when we talk about shared decision-making, the idea is to facilitate self-advocacy, right? So it's not for the doula to help the family to make a decision by, you know, being inserted in the conversation and taking charge of what's going to happen for that care, but to explain and facilitate dialogue, and a lot of times, you know, serve a little bit as a translator, sometimes medical jargon to some folks that are really hard to understand, or just to remind, you know, clients that they have, you know, the opportunity to ask questions if they feel like they would like to do so. And, you know, to provide that active engagement by parents, because according to Eugene Declercq's study, the reason that people feel good about their birth experiences is really when they feel like they're part of the decision-making process. So if they are actively engaged, even when they don't plan for medical intervention and then are faced with medical intervention, they were still going to see their birth as a positive experience because, you know, they were part of that decision-making process. So this is really big, and I feel like shared decision-making is kind of the buzzword right now. Everybody's talking about it. It's not just in obstetrics. So it's really important to, you know, carry that culture of communication, and I feel like the doula can help with that role as well. Next slide, please. And confidence building, you know, I think a lot of times for the person who is in labor and for the partner, if it's a first baby, you know, they don't know if they're doing well or if they're doing right. And, you know, we know how much somebody who is confident will labor in a more efficient way, per se, because they, you know, recognize that what they're doing has some value. So I think that is very important. It plays a very positive role in the birth of a family, feeling confident. Next one, please. And then a relationship-based care, you know, a lot of times in big hospitals, the providers attending the birth may not necessarily be the ones that have seen that family for prenatal care. So the doula does bring some knowledge of their preferences, their desires, also their fears, maybe history of trauma, and that can be a really important bridge in between the hospital staff and the family. And even if they do know their care provider, you know, we all know that in most situations the care provider is not there most of the time. Next one. And again, you know, bridging that family cultural needs with the hospital staff. And, you know, a lot of times, like, these things can be silly to some people, you know, but we have so many beautiful stories here in Los Angeles because we are such a diverse city. but, you know, like women that would come to the labor and delivery room and want to have like a safety pin attached to her underwear, you know, because that was what her grandma told her to do. And, you know, a lot of times if there is a language barrier, it may be hard for them to communicate that with the staff. And, you know, the staff may not understand why there is a safety pin in her underwear. And if she needs to take her underwear, you know, what do we do with the safety pin? And yes, it is, you know, not going to medically affect the birth, but for the memory of that person giving birth, you know, having that safety pin close to her, and if it needs to not be in her underwear, perhaps in the hospital gown or even in the pillowcase, is something that really affects the perception of that experience. So those are some details that obviously for the medical staff, it's hard to take care of that as well, because there's so many other skills that are being used, but the doula can be focused on, you know, the poem that she wants to be read to her or the prayer that she wants said. So those are things that really affect the experience of people giving birth. Next one, please. And then, you know, I think that mediation is a huge role of the doula, and that is where a lot of times people confuse a little bit of the scope of practice, because, you know, in the advocacy role, a lot of times when they read that doulas do not speak for their clients, some people interpret that means that doulas don't say anything or they don't ask questions, and that's not the point at all. The point is sometimes to help the clients to communicate or to find their voice or to be reminded that they can ask a question. But like I said earlier, a lot of times, you know, there is a misunderstanding of what does that really mean, or what does that treatment is going to mean for my labor, how are things going to look like. So the doula just has a little bit more time to make sure that they ask those questions and that the medical staff explains everything to them. So that, to me, has been one of the greatest benefits of having doulas inside a hospital, is really, you know, to help the hospital to understand that family a little bit better, and to help the family to understand a little bit more of the plan. So increased communication is definitely, you know, something that we never lose by communicating well. Next one.
Can I add to that too, Anna Paula? Is going back to that slide, sometimes as providers, I mean, we as doulas and childbirth educators too, sometimes we're in such a work mode that we forget that the medical terminology that we're using, they may not have read about at all or heard. And so sometimes when we're there, the doulas are there with their clients, that as Anna Paula says, we're not, when we do speak, it's not to look at the families and say, okay, well, go against what they're saying. It's all about, you know, so did you understand what your provider just said to you? And if not, okay, then we can ask, can you please explain that to us one more time so we're clear, so we can make an informed decision for us, whether it's a decision that they need to pause and think about, or if it's a decision that they automatically know, yes, okay, I got it, I want to go this way. So that's more too about where doulas are in the mediation process. Next slide. Go ahead, Anna.
Oh, no, it's okay. You can go. It's like,
okay. So doulas are there also to provide non-judgmental support. A well-trained doula will come in, and they don't have to be certified. Remember that, you guys. They can be, as long as they're trained, it really helps them understand what their role is. And so the role of a doula is to provide non-judgmental support. So helping them before they go into labor to get the information they need to make those decisions for themselves, and understanding that there sometimes are roadblocks, and sometimes there are obstacles, and sometimes things change up that we don't expect to happen. So to help them prepare for the best case scenario, but also help them to prepare for the what if. And if the what ifs happen, then what questions do we give them? What resources do they have available to them, so they can read things that are evidence-based. They can start asking their questions of the provider, of the hospital when they do their tours, of the nurses when they're in labor with them. They can ask these questions and say, hey, you know, can you explain this to me? What's the benefit or what's the not the benefit of doing it this way? So providing that information without bias is the role of a doula during labor and before labor as well. And then also during labor, we are there to help families get through labor, and sometimes we have to think outside of the box. Doulas, all of us come to our clients with different knowledge, different, as you see from earlier, sometimes they have additional certifications and other things, and sometimes they have a strength in one area and not another. And that's where I think the nurses kind of can come in as well with their clients, is that maybe a nurse does have some labor support, comfort measures background, and she can say, hey, have you tried this? And together as a team, when there's a road bump, there is somebody can go, oh, okay, let's try this. And so together we work with the mom and the partner to change things up when it's necessary, so that not everybody feels so scared and wondering if this is normal or not.
Yeah, and just to add to that, I just want to say that, you know, this is also the part that I believe nurses and doulas have the most fun, you know, because most people don't become nurses because they want to be charting in the computer. You know, they become labor and delivery nurses because they do have an appreciation for the process of labor, because they do have an appreciation for, you know, human anatomy and physiology of labor and birth. So when we collaborate in such a way, we have fun together, you know, so you add together the skills and the experiences of the nurse and some trainings that doulas may have had that, you know, nurses may not yet be familiar, like the use of rebozos or, you know, some midwifery trick that they saw in a home birth. And that's another thing that, you know, doulas don't attend birth in a hospital only. So we attend birth in a home birth or in a birth center, we learn something from home birth midwives that sometimes, you know, as long as they are inside the scope of practice and they are comfort measures, they can be very helpful with, you know, a labor that has stalled or, you know, any kind of dystocia, either emotional or physical. And I have had such incredible experiences in, you know, trying things with nurses that even if we don't know if it's going to work or not, you know, but sure, let's give it a try. And a lot of times we are surprised that, you know, things do work, or even if they don't work, it does help the family to feel like that there is collaboration and that everybody's putting an effort together, you know, to attend their birth and keep their goals of either a vaginal birth or a medicated birth in mind. So it's really the best of the experiences when nurses and doulas collaborate, and we see that more and more. Next.
And something that I wanted to add to that as well, and it kind of goes with, you know, all of these beautiful pictures here too, is that doulas can be hired for not just for a family wanting an unmedicated, unintervented vaginal birth. Some families hire doulas straight up knowing that they want to have medications during their labor. And some doulas are hired as well to for C-section births, for planned C-sections. So we can provide, doulas can provide support in no matter what type of scenario. And it helps the nurses, it helps the providers have that support for their families as well, whether or not you know, get to know the doulas in your community, but helps take some of the burden off of them so they know that their family has a little extra support, has a little extra guidance, and that their patients will rely on them for the things that the doula cannot. And so, thank you. Anything else you wanted to add, Anna, Paula?
No, I think that's perfect, you know, and I think that is definitely a misconcept that people have of the role of the doula. You know, you have to keep in mind that the support that doulas provide is physical, emotional, and informational support. And people that either choose medications or that need medications, a lot of times they need more support than if they didn't, because then it becomes about what's that noise, or what's the next thing that's going to happen, or, you know, why is it, am I itching, or whatever it is. So it is really important, and I believe for cesareans too. You know, a lot of people choose a cesarean birth for trauma issues, or they have a breech baby and, you know, their provider will not do a vaginal birth, so they had planned everything for a vaginal birth. Now they have to adjust to a surgical birth. So those can be very big challenges for some families, and having somebody there that can help them to navigate the emotion aspect for those changes is huge. It definitely impacts how they perceive their experience. All right, well, thank you so much. I think that now we will open to questions since we have about 15 minutes.
Thank you so much, Anna, Paula, and Michelle. This is Valerie. I've captured the questions, so I'll just kind of go through them, and you can answer as you see fit. The first question was from Liz. Is there a policy or a consent form that you would share to use at the hospital for doulas?
I can definitely get permission from Cedars to share the documents that we have developed there. And, you know, it's quite simply the Donna International Scope of Practice with, you know, some friendly words and additions. But yes, I definitely can see through that.
Okay, and if you can share that with me, I can get it back out to the participants. So,
okay.
The second question is, could you provide more explanation on something about the fees-based hospital collects a fee from the family?
Yes, so in these programs, you know, there is various models. So, you know, there is different ways that different hospitals are addressing this, but some hospitals would collect a fee from the family and then pay the doula and possibly have a profit in there.
Okay, and the next question, how do labor and delivery nurses address the vast differences in training and awareness of hospitals' protocols and standards of care?
So I would like to answer that one if that's okay. You know, I really think that it's important for nurses and providers to be proactive here. And the reason for that is that if you know you're going to be working and seeing more and more doulas in your facility, that you'll want to get to know about what's out there, what's available, what are your families seeing. And I think that's number one. I think that can help a lot. That way you can understand. One of the reasons why we brought up the 4 bigger doula training organizations is that we wanted you guys to see what the majority of people are certifying through, what organizations the majority of the doulas are certifying through. The basic standards of practice and code of ethics is simple. We are not trained primary care providers. We offer emotional, physical, and informational support only. And with hospital protocols, I think it's really important that you help your doulas get to understand, hey, you know, kind of this is what we do. And but also understand that sometimes families will eventually decline something that we may not, none of us may agree to, even the doulas may not agree to. And how do we help those families, and how do the doulas and how do the care providers and the nurses help those families understand that, hey, this might be what we need to do today. So I really think it's important for everybody to be proactive when it's understanding the doula's role, when it's understanding the community. As Anna Paula said, there's so many different types of doulas, type of people in general that come in and see their role and in one way, and then, you know, somebody else would see their role in a different way. But really getting to know the people in that are coming into your facility. I know I made it, I'll give you an example. As I was coming up, doulas were not popular in our local hospital, and I killed them with kindness, you guys. I would go in and smile and hand them my business card. Hey, my name's Michelle, and, you know, if you ever need anything, let me know. And I'm here, you know, to help them, and I'm here to help you. And it really helped to bridge that gap. And so now there's a positive, you know, understanding of doulas. And while, you know, every now and again there's somebody that rubs somebody the wrong way, but I really did my best to help bridge that gap, to help, you know, be proactive and, you know, helping them know who I was. And I think it's vice versa. You know, I have other nurses come to me and say, hey, did you know I trained as a doula before I became a nurse? No, I didn't. Tell me about that. And so it's really nice if we can have 5 minutes, 10 minutes with somebody while mama is doing her thing and then going aside with your doula, getting to know them. I think that really helps everybody. I hope that answered your question, Liz.
Okay, the next question that we have is, do doulas do deliveries in the OR at Cedars?
That's a very good question. Then the answer is depends. There is not an official protocol. Actually, the official protocol is one person, one support person in the OR. But it really is case by case. I think it is, you know, some practicalities as far as, you know, which OR is it? Is it the smallest one or the biggest one? But who is the anesthesiologist, who is the OB, and who is the doula? So, you know, I would say at Cedars and in a few other hospitals, it really becomes a matter of the situation. And until that point, you know, does the team see the doula as somebody who behaves in a professional manner, that they can see a benefit in having that doula in the OR? And, you know, just tagging along to what Michelle was saying, everything is a combination of, you know, your professional representation and personal relationships. You know, everybody working in a professional scenario can represent, you know, your entire group or yourself in a way that is positive or negative. And that is another benefit of going through a training, because those are things that we do address in a training. It's like, you know, how do you behave with the rest of the team? You know, don't wait for somebody to come introduce themselves to you. Go and introduce yourself to them. Get out of the way. Don't touch anything that is blue. You know, those are basic things, but, you know, it gives them a little bit of the lay of the land. You know, a lot of people becoming doulas have some sort of experience, but a lot of people have never been to a birth before. So, you know, going through a basic training really do give them a little bit of the etiquette of, you know, going to a hospital and understanding that, you know, you're basically going to somebody else's house, and you have to be a polite guest. You know, you have incredible value and you want to be welcome, but there are some very basic, simple rules, but those are also, you know, rules that apply to any professional environment. You know, that when you are new, you know, you listen more and you can ask questions, and, you know, and I think like that's really how doulas are gaining space. The example that Michelle gave is perfect. You know, like same with me, like when I started to work as a doula, same places that today I am extremely welcome, it wasn't necessarily the case in the beginning. And it's either because, you know, people had a negative experience, or because they didn't know what it was. You know, and it's a combination of, you know, more positive experiences that hospital staff are having with doulas. But I do think that we need to unify and clarify and all, you know, speak the same language of what are the true benefits of a doula support. And you know, having that person. And again, that's not to say that other people cannot provide support to a family, but, you know, a laboring person may have very individual needs that only a doula may be able to attend.
So there's one last question I'm seeing. Do you only allow trained doulas to be in the Cedars unit?
Yes. They do have to be trained through, you know, an organization, and then they have to go through our little training as well. But for the Cedars committee, you know, it's a 3-year term. The goal is to, you know, rotate nurses and doulas so we can continue this dialogue. Yeah, but they do have to have had some basic training by a reputable organization.
Okay, thank you. So we have just a few moments left, a few minutes left on the call. If there's anyone else who has a question and they want to type it real quick in the chat box, we'll address it. We'll give them just a minute to type it in.
Somebody wrote, how do you verify training?
For training.
Yes, it depends on the organization. You know, if it is one of the larger organizations, it's very easy. We, you know, can either ask them to provide documentation or certificate from their training, or you can verify with the larger organization. Most doulas, you know, they are very proud of the organization that they carry. Also, you know, communities, even Los Angeles being a big city, in the end of the day, you know, we are a small province. We all kind of know each other, the community of doulas. We also have a local doula association. We have many meetings that we get together. So, you know, you tend to know the doulas, but we do verify certification or training through, you know, reputable organizations.
Okay. Do they have to have hepatitis and TB and flu vaccines?
I believe if they work for the hospital, yes. If they are independent contractors, no.
Okay. So if they work for the hospital, yes, and if they're independent contractors, no. What training does the hospital provide for community doulas?
You mean for those who come in to work for the hospital as doulas, or independent doulas?
It's not clear from the question.
I think it is, you know, for the ones that are probably going to be part of their program. I think that, you know, it's similar to what I said earlier. It's basically for them to understand the culture of that hospital, a little bit of the lay of the land, you know, and maybe some particulars of, you know, each hospital.
Okay, and the next question is, are there any grants available for generally low-income patient majority hospitals to start a program?
I don't know of any grants per se. Do you?
No, sadly no. But hey, if somebody there would be willing to write one, that would be a wonderful thing to start. Please email me.
I think that's where they usually pull in the volunteer doulas. So for those who want to support the low-income clients, although, you know, it's hard because, I mean, even those doulas who are well paid, sometimes they will take on low-income clients once or twice a year. So unfortunately, we don't know of any grants specifically for hospitals that you can reach into or request. So that would have to be something that you would have to, you know, reach out to your higher ups and say, hey, we would like to provide this service and we would like our doulas to get some sort of small stipend or to get paid, and how can we do this to do that, to allow that to happen.
And so their last question is, what happens when a doula comes in not trained? And I'm wondering if maybe the question is not trained but not certified, because they all have to be trained, right?
Not necessarily. I mean,
okay.
There is nobody verifying that.
Comes in not trained.
Well, I mean, if you're in a hospital-based program, I don't know of any hospital-based programs who do not want their doulas trained. If it's a community doula, then you don't know whether or not they've been trained as a doula, and unless they volunteer that information, I mean, it's not something that you're going to know. No, but definitely, if you're wanting to build a hospital doula program, absolutely. I do not know of any hospital doula program that don't want their doulas trained, because they want them all on the same page, and they won't necessarily, it depends, you know, sometimes hospitals will bring a doula training to their hospital, so that way all the doulas who are there, who are all trained on the same page, the same organization, the same group, and the same way, and I think that's absolutely beneficial, but it just, you know, it depends on what kind of program you want to build.
And so I think this will have to be our last question. This person says they've had some wonderful doulas, as well as some who are very hostile towards any medical personnel from the time they arrive. And how do you recommend dealing with this kind of hostility?
that is really challenging, and and I'm sorry to hear that that still happens, but we do hear that as well. I would say, there is nothing wrong in calling that doula outside of the room and saying, hey, we love that you're here. We understand the benefits of doula support. We welcome doulas here, and yet, we do need to find a way to communicate better. And then perhaps for hospitals to have any kind of a channel that, this nurse can have somebody to talk to. Until we had our committee, what I would hear is that they had a list of the naughty doulas in the hospital, so like, they would keep the names of the doulas that they had issues before. And, that's not necessarily the most organized or efficient way that will cause change and improve the situation. So I think, like, a committee that addresses that situation is a really wonderful way for people to have a place to share their frustrations, but more than that, come up with solutions for those situations. But again, it's still individuals working together. So, I would say sometimes a conversation helps. And, again, another tool may be to have a document that you can present to that doula and say, listen, we are so happy you're here, you're a great doula, but here's how we see the role of the doula. And, here's a couple of things that I have been observing that you're not fulfilling that role. Like, do you have any suggestions how we can, better work together? And again, a lot of times doulas mean very well. They are there really invested in, making sure that family has a good experience. They may just not be good communicators. So, a lot of times taking them out of the spot may help them. You're very welcome. Thank you for that question. I'm so passionate about this. I loved every single one of questions. Thank you.
Well, thank you to Ana Paula and Michelle for the great webinar today. We appreciate everyone being on the call and for your questions. We will post a link to the recording for this WebEx on the CMQCC website underneath the webinar section. So we thank everyone for being with us today and have a wonderful afternoon. Take care, everyone. Bye-bye.
Thank you. Bye-bye.
Thank you.
Thank you.